Assalamu alaikum wa rahmatullahi wa barakatuh. In this episode of Health Guidelines for Hajj and Umrah, inshallah, I'm going to be talking about immunizations. Vaccines are very important because they have been shown to be very effective in combating disease. Allah subhanahu wa ta'ala in His wisdom has shown us a way in which we can protect ourselves. It is compulsory to take the 4-strain meningococcal vaccine when you go to Saudi Arabia. It is compulsory for everyone because meningitis is endemic during the Hajj period. Yellow fever vaccine is necessary for those who are living in sub-Saharan Africa. So people who are going from South Africa would need the meningitis vaccine and the yellow fever vaccine. Visas for Umrah and Hajj may be refused if these two vaccines are not taken. If you went to Saudi Arabia without taking these two vaccines, they have a right to quarantine you for up to 2 weeks. Remember, meningitis is endemic in Saudi Arabia during the Hajj period. Most people during Hajj develop influenza due to the crowded conditions that we encounter. It is therefore very important for you to take the latest influenza vaccine. Although it may not protect you completely, you may develop a milder infection. So you must consider taking the influenza vaccine. Hepatitis A is spread by infected water and food. Hepatitis A is also endemic during the Hajj period in Saudi Arabia. Food is safer if prepared by your agent in a hygienic environment in the hotel. Food that is prepared by unknown vendors and in unhygienic environment is suspect. So please try and avoid them. Hepatitis A virus can survive in fresh fruit and vegetables. One needs to exercise caution when eating raw fruit and vegetables, as in salads. Fruit can be washed very thoroughly before eating. Salads should only be eaten from reliable sources. Taking the hepatitis A vaccine will most likely protect one from the illness. Also, another vaccine that's important is the Streptococcus A and Streptococcus B vaccine for those people who are vulnerable, who are prone to infections, and in whom an infection can be life-threatening. That is, in those with asthma, chronic obstructive pulmonary disease, emphysema, recurrent pneumonia, diabetes, cardiac disease. All these people need to consider taking the Streptococcus A and Streptococcus B vaccines. Some of the other optional immunizations are tetanus, polio, and hepatitis B, especially for healthcare workers. Although the Saudi Arabia is in the malaria belt, the risk is low because of the absence of stagnant water due to desert conditions. Mosquitoes cannot breathe. All immunizations, remember, must be taken at least 14 days before departure. So remember, the meningitis vaccine is compulsory, and in sub-Saharan Africa, the yellow fever vaccine is compulsory.